Hey guys, it's Sunday, January the 17th, 2021. It is post-COVID vaccine dose 2, day 9 for me. Again, I had the Pfizer vaccine. I'm doing great, no issues from the vaccine. Didn't wake up with a numb toe or tingling toe this morning, so that was good. As far as vaccinations, in the US, we've had over 12 million people receive the vaccine. Over 1.6 million have received the second dose, so that's great. As far as Gaston County goes, we have 119 people in the hospital due to COVID. We have 17 people on ventilators. That took a really big jump this past week. At the beginning of last week, there was like 8 or 9 people on the ventilator or a breathing machine, and now we're up to 17. Big jump, people. And wanted to update you guys. I know a lot have already seen this, but North Carolina has changed the groups. There's no like group 1A or phase 1A, group 1, 2, and 3. They got rid of all that. They made it a lot more simpler. And so we've got 5 groups. First group is healthcare workers and long-term care staff and residents. Second group is older adults. Older adults being 65 and older now. Third group is essential workers, post office workers, teachers, food and agriculture, first responders, police, firemen, that kind of thing. And then fourth group is adults at high risk for exposure and increased risk of severe illness. And then the fifth group is everybody else. So, you know, it makes me nervous a little bit that it's not until the fourth group where we have our people with, you know, higher risk for serious illness, like, you know, people, and this would be people less than 65, you know, with diabetes, heart issues, that kind of thing, cancer, transplants, kidney transplants, lung transplants, liver transplants, just transplant recipients, those people at risk for serious illness from COVID. Under 65, that seems like a little while for them to wait. I feel like, you know, they should be getting the vaccination. You know, it seems like far away, but again, you know, right now that's how it is. So we need to wash our hands. We need to avoid large crowds. We need to wear our mask. We need to do all we can to protect ourselves, everybody, but especially those people at high risk who can't potentially get their vaccine until we're in group 4. So it's just even more important to protect those people. And we can do that by the people that can get their vaccine, and everybody, whether you've had your vaccine or not, wear your mask, avoid large crowds, wash your hands. If you go to church, wear your mask. At church, you're in a large crowd, wear your mask. So I just encourage everybody to please, you know, do those things to protect yourselves, but to protect others who can't get the vaccine yet. I did want to specifically talk about Gaston County and Caramont Health. Caramont Health has now said that they were going to vaccinate their patients who are in that group 1 and 2. So if you're 65 and older, that means if you're a patient at Caramont, whether your primary care provider is a Caramont Health provider, physician, nurse practitioner, physician assistant, if that is your primary care provider, or maybe you have a primary care provider in another system, but you see a specialty in Caramont, like you see a cardiologist who's a Caramont Health provider, or you see an endocrinologist who is a Caramont provider, or any other specialty gastroenterologist, stomach doctor, liver doctor, diabetes doctor, heart doctor, lung doctor. If you go to any of those doctors or providers that are a Curamont Health provider, if you are 65 or older, you can call their office and they can schedule you for a COVID vaccine. And I encourage you to do that. And then I'm sure it'll open up to the other groups as soon as we get to those other groups. If you have any questions, please let me know. Otherwise, have a wonderful evening, and I will speak to you guys tomorrow. Bye.